Pregnant women must know the importance of ANC, antenatal care, the importance, why it is really important for a pregnant woman to visit the hospital from time to time to be checked, so that during this journey of your pregnancy, you can be monitored, you can be advised and helped. Our director, a midwife, a professional midwife, will educate us more on antenatal care.
Thank you. Antenatal care. Antenatal care is the care given to women once they are pregnant. We advise women once you miss your menstrual flow after 1 month and you go for investigation or find out that you are already pregnant, you should visit the hospital and register antenatally in the first 3 months. Why that first visit is very, very important to be done in the first 3 months is for the client and the health worker taking care of her to know her state of health from beginning of that pregnancy. Because a lot of tests, investigations will be done. While in subsequent visits, those things of which was noted in the first visit, will be they will be checking through them and knowing what developed because of pregnancy and what was in the body before the pregnancy, to know how to take care of the mother and child. They are advised to visit the hospital so that they will be given advice on feeding, exercise, dressing, drugs to take and not to take, and even what to do and how to eat and how not to eat, so that you will not have a big baby, making it difficult for you to have a difficult delivery, especially where it can be curbed, where it can be controlled, because sometimes big babies are not is from parental lineage. Hence, the advice or what the women will look at they will be educated. And once anybody attends antenatal clinic, the person attends it on time and listens to the lectures being given. Because some women just go to antenatal. They can even come when the whole thing is ending. They will only be checked and they go. That is not antenatal. Because we have time for lectures to the women. Those who follow this instruction, those who follow the lectures they hear, the knowledge they acquire from hospital, they don't have anything that perturbs them, because for everything to happen, they know what it is and the stage they are. And it is when you go to hospital that you know when to take your tetanus toxoid, you know when to take your anti-malaria drugs, you know any other illness coming up will be noticed on time, so that the mother and child will be monitored all through the 9 months and we will not have any complication both during the pregnancy and delivery.
Yes.
Thank you.
Can I ask something like all these special ones? You see a sickler, she's pregnant. Someone with high blood pressure.
Yes, that is why I said the first 3 months of the mother being pregnant is very, very vital. The person reports so that you start in time to monitor the person accordingly. Because once you know the status of the person in that first 3 months, you now know how to handle the person we handle antenatal patients now individually. We handle them holistically according to the person's own build-up. Some are diabetic patients before they get pregnant. Some in that first 3 months, you notice that the patient is not diabetic, but in the next 6 months, the person is diabetic. You now know that this is pregnancy-induced diabetes, and you will now change how you treat the patient. Some have hypertension. They don't have it in that first 3 months. But once they develop it, then you will now have the idea of how to handle that patient so that the person doesn't run into a clantic fit by the end of the pregnancy. Some swell up. Once you see a patient that has edema all over, the person will run to the hospital because there are other tests to run to rule out this fit they have before delivery.
Even the HIV patients.
Then, if it's a HIV patient who may know or may not know, you now know the treatment to place the patient on, know the advice to give the patient about the baby that is being expected. Many women now are HIV positive, but their children are not because of advice, because of drugs they take. They know how to handle their babies so that they will not transfer the HIV to them.
So we've heard it from horses about the importance of this antenatal care. If you're a pregnant woman, take care of yourself, your unborn child. So that during your 9 months journey and at childbirth, there will be no complications. Thank you.
Thank you.